So I think one of the critical things, Sue, is we're trying to find a way to improve patient satisfaction, even absent the OAS caps, is by improving patient communication. Mm-hmm. In other words, how do we communicate with patients before? How do we make sure that they're well prepared for the procedure and understand what's going to happen during the procedure and what will happen afterwards, what your discharge is going to be like. And I think the pandemic has really changed the way that we communicate with our patients. Yeah. One thing that we always had done in the past is we allowed family members to come back after the procedure is done and, be with the patient to hear the discharge instructions and to help the patient in recovery and make sure that the family member, hears the things that the patient might not hear because of either the procedure that was being just recovered from the procedure or, of course, the anesthesia implications of it. In many of our centers, for example, still the family members are not back yet. So good communication with not only the patient, but the family members is extremely important. And of course, with that, post-op communication is just as important. How do we communicate with them to make sure that they recovered well? That is an accreditation standard, for example, that we need to have good communication, or we need to communicate with the patient to find how well they recovered after the procedure. So as we move into the new era, Sue, when I was down in Texas, I was on a panel, and I think I'm going to mention this in a previous episode. I was in a panel talking about marketing. And a lot of that conversation talked about, how we have a social media presence, what happens in our websites. And I think it's very apparent right now that people are becoming much more comfortable with electronic communication, which means that we really have to start thinking in the surgery center as to how are we going to communicate with patients that are more comfortable with electronic communication, which means that we need to spend some time looking at our websites, making sure that they're useful to patients, and then looking at our communication prior. I think it's fair to say that telephone communication is starting to decline. I think most of us still rely on it, but I think we're going to be finding us using more websites, for example, for preoperative conversations about the procedure. We'll have asking our patients to log in and give us their health history from a website as opposed to getting a telephone interview. Now that's a slow process, and I don't know how long it'll take to move in that direction, but that's certainly the direction we're heading. So you need to spend some time looking at your website, determining its usefulness, and making sure that you keep it up to date. Likewise, with email, you need to, make sure that you have, if you're going to use email, that you do it in a proper way, that, that as much as possible, you keep that information confidential. And now we're also starting to see texting. Now, the problem with both email and texting is that can be quite problematic from a HIPAA standpoint. Much more so than, telephone calls. At least you can try to make sure who you're talking to on the other end. So what we decided to do is we decided to call upon Spencer Kelpe, and he's with an organization called Dialog Health. Now, Spencer's company has a tool that would allow a HIPAA-compliant communication with the patient. But what we asked in this interview is to talk about patient engagement, the different aspects of it, the different times that we communicate with a patient, and how an electronic solution such as his, and there are many other, competitors out there, but specifically, how this type of a patient engagement can happen. So let's listen to this interview with Spencer Kelpe, and after that, we'll go into our section 3. So Sue and I are here with Spencer Kelpe. He's the Director of Key Accounts for Dialog Health. We're going to talk today about patient engagement, patient satisfaction, how to engage patients better in our surgery centers. Welcome, Spencer.
Thank you very much. Appreciate you having me.
So you work with a company that basically has a texting solution that helps surgery centers to find a better way to communicate with their patients. So we thought we would talk about what are different ways that we can engage our patients better? How can we communicate with them better? I think in today's environment, as we're starting to see more patients coming to the surgery center that perhaps might have been going to a hospital, for example, in the past, are finding the surgery center solution much better since nobody wants to be in a hospital, with COVID. So why don't we start by talking about how we can actually improve clinical outcomes? I think, if we're going to start by talking about anything, let's talk about the most important thing. How can we actually improve the quality of care that we're providing to our patients and the outcomes that a patient has? So can you talk a little bit about your thoughts on that?
Sure. There's a couple of ways. And one of the most popular that we're finding is, since it's ambulatory, right, there's a lot of responsibility that's actually put onto the patient to prep, to make sure to remember their appointment. So what are they supposed to do before coming into their appointment? What are they supposed to bring? What are their COVID policies?
Right.
All of these sort of things we're asking the patients to remember or do. So I'd say if you want to improve clinical outcomes, the best place to start is educating them or hitting the easy button really for them before they ever even come in for their appointment. And the best way that most people today in their busy lives find that is just texting it, right? Give me a text reminder when I need it, when I'm supposed to have it, that, hey, you have an appointment. Are you still coming in? Have you forgotten about it? Did you schedule something else? You're going to be out of town.
Do you know what time it's going to be?
Right.
Yeah.
And then also links, right? So most people, when they have a cell phone these days, they don't just have a flip phone that texts, right? There are populations that do, but most even have smartphones. They've got iOS or Android. So you can hit the easy button for your patients by click this link. Here's all the things that you're supposed to do for your prep before you come in. Or here's the paperwork we're going to ask you to bring whenever you come in, those sort of things. Or if you need to reschedule, click this link. Let us know, not just that you're not coming in for this appointment, but we also want to keep you in our network. So let us know when you can come in. When would you like to reschedule? So, improving clinical outcomes by doing those sort of things, that's going to improve a lot more on-time starts. Also, one of the big headaches that ASCs will deal with, and pretty much any operational person will tell you the same thing, is no-shows, 24-hour cancellations, no-goes, right? Those sort of things. So, by just simply communicating a little bit better, a little bit more conveniently from the patient experience, you can improve those outcomes. And then by putting in those things that we talked about with the, hey, here are your instructions that you're supposed to do. This is when you're supposed to start your prep. Remember, no coffee tomorrow morning or anything until after your appointment. Sending those pieces of information at the right time, like the evening before when they're sitting down for dinner, that's a great time to improve those no-goes or non-compliant patients as well. So I'd say start there before they ever get into your care, before they ever come in. That's where you should be starting that communication piece. And then you've got them in your database. You've got them used to texting and communicating the way that you want. So if you progress a little bit further, hey, here's an easy way to pay your bill. Here's an easy way to remind you that for your colonoscopy, your endoscopy, these things that are recurring events that may happen every 1 year, 5 years, what's the best way to let them know, hey, records show it's time for you to go ahead and schedule this. Continue it with that text.
Just going to say, it does seem like most centers that we work with, the biggest cancellations are either the no-shows or often people that forget they can't have their coffee in the morning or they can't have any breakfast. So, that could really improve things quite a bit.
Well, and if you think about the history of the way we engage with people, I am so frustrated with email right now because, you and I are doing this interview. I'll be away from the email for about an hour. When I go back, there'll be 100 emails that will have accumulated. Needless to say, things get missed. I throw things out in my email that I probably shouldn't. And so much of our email just, distracts us from trying to get things done. And of course, before that, we had telephone, and then we had the mail. Nobody uses the mail anymore for this type of engagement. And telephone, people frankly don't, answer the phone unless it's a number they know. Mm-hmm. So I think you're right. I think the next genesis is going to be, the next transition is going to be toward more texting, where we have much more patient contact, especially with cell phones getting to the point where, as you said, you can put a whole bunch of links in there that they can use to immediately respond to any of the things that you've indicated need to be done prior to the surgery.
And I would say, so kind of walked over this and we said, yeah, I think the future will be texting. That'll be the next thing. It's not the next thing. It's already here. Right. Well, the people are already saying hey, this is how we communicate, not only with our friends and family, but this is how we expect to communicate with businesses, the restaurants where we make appointments. And hey, if we're online shopping, what are my delivery updates? What's all this helpful information that I can just take a quick peek at? Right. And it's not going to interrupt my day. Right. So that's the only thing that I tell people when they're saying, yeah, I think this texting, that really is the way to go, right? That's the future. Yeah. It's already here. We're just a little bit behind. We're just catching up to it.
Mm-hmm.
Well, and I want to put this also in the context of quality improvement here. And again, just for our listeners, if you're going through your quality improvement and you find that your satisfaction, well, a couple things. First of all, as Sue mentioned, if your cancellation rates are going through the roof, if you're finding that you can't get a hold of patients beforehand, that's the type of data you should be collecting up front is, how frequently can you communicate? Can you connect with somebody by telephone beforehand? If that number is dropping, then it's time to start thinking about other solutions. Likewise, if you're finding your cancellation rates going up on the day of surgery because people did not do what a telephone call would have told them to do beforehand, or what they were given instructions in the office to do that they just flatly forgot, then that is, again, another time to start thinking about other ways to engage with the patient beforehand. So I think, Spencer, you hit it right on the nail there, right on the head there, this is something that I think you're going to find those numbers increasing. And you need to keep a track of it through your tracking and trending methods in your QAPI program. Mm-hmm. So that kind of leads us into the next area, which is improving staff workflows. It kind of does tie into it. Why don't you tell us a little bit about how you think this new way of engaging with our patients, or expanding the way that we're already engaging with each other into the healthcare field, can help improve staff workflows?
Think about what the current workflow is today, right? For a lot of people, it's, okay, I'm going to look in my schedule. If I have 30 cases today or 30 cases on Friday or whatever it is, you look into the schedule and then you start picking up the phone and dialing people one by one. So you look up the record, pick up the receiver, dial 10 digits so somebody answer. If not, leave a voicemail. And that's only if they'd have a voicemail where the voicemail box isn't full or set up yet, right? And you're like, great. Now this will be a, red flag for a non-compliant patient coming in again. Versus, so if you take that and then just say, hey, before we start picking up those phone calls and calling people one by one, I'm going to quickly look into a software, a solution to say, how many of these people got texts that said, hey, are you coming in? How many didn't get that text? Maybe they don't have a cell phone number, but I can quickly and easily see who does or who doesn't. How many phone calls can I, remove? And then from there, if you've got, say, two-way texting, in my opinion, way better than a notification system that just says you have an appointment. But now you can actually see the people who said, yes, I'm going to confirm this appointment right now, right? Or no, I don't need any follow-up assistance after my appointment. I'm self-identifying on my own time and at my own convenience. I'm okay. So now before you go in and start doing, hey, I'm sending out all of my emails or I'm making my phone calls one by one, do a quick scan. How many of those have I eliminated? If you eliminate 25 out of those 30, well, great. That's time savings. That's just going to compound every single day. So that's the immediate thing that I think is, from the staff perspective, is just that time savings of, I don't have to just keep throwing more resources because my metrics are increasingly getting higher in terms of no-shows and no-goes or, follow-ups or readmittance or those sort of things. So you don't have to throw more resources at it, right? You can just install a technology you offset some of those.
Yeah, and then especially when we're in an era right now where our nursing staff who are often the ones that are making those phone calls. Now, depending upon your organization, that might be different. It really doesn't matter, though. I mean, we're all short on staff right now, and the more that we can improve the efficiency of the nurses, so that they're every time that they make a phone call that they don't get through to a patient is wasted time. Here, I think what you're saying is that, that if the system can make that connection so that the patient then calls, or that you're going to have a live number to call afterward, after the text message goes out, that's going to improve the efficiency of the nursing staff that are making those pre-op phone calls. Actually, and the same thing can be said. I know we're going to talk about that in a bit, the post-op call too.
I mean, that's a perfect segue, right? So that's a lot of places where ASCs, they go, you know what? All of this stuff that Spencer, you mentioned before an appointment, that sounds really, really, really nice and good, but we need more bandwidth. That is our pressing issue. That's our burning deck. What's the number one thing you can think of to save staff time? Do you do a post-op check-in? Yes. Okay. Do you call 100% of those patients? Yes. What if I could remove 80% of those? Okay. That's where we're going to start, is just, you don't need to call everybody to find out who you need to call. Find out who you need to call, then call those people. And it's probably like one or two, right, on any given day. And then the other thing that I find too with these businesses is, if you've got, say, a recall program, or if you've got mailers that go out to people, or you're emailing, it's hard to track the metrics of a mailer or how many of these phone calls were successful, right? You made the phone calls, but it's much harder to track those sort of things. And I think data these days is starting to drive a lot of the business decisions on how do we become more efficient? How do we get a better patient satisfaction? How do we improve our benchmarks? So if you've got a technology and a solution in there where everything is logged, it's easy to say, I'm calling everybody now, our no-show rates are 10%. Yeah. I added texting. Is it easy to quantify? Yeah, that went down 20%, 10%. And I think that's the added benefit of workflow efficiencies on top of just not making phone calls. You can look at the data that you've got in your system and say, well, this worked well over here. Could we also apply this over here? Could we apply it to bill pay? Could we apply it to post-op? Could we apply it to recalls? All of these different types of programs that you're looking for. If it's in a trackable solution, it makes it easy to just start compounding efficiencies on top of efficiencies.
Well, and let's point something out here too, is that the standard texting solution that we all have, using your cell phone, is not ideal for this, because we still have to have documentation of that post-op engagement as well as the pre-op engagement. So whatever system you have has to have that capability of documenting that interaction that you have, or the computer had, with the patient, so that you can put that into the patient chart afterwards, both the pre-op and the post-op side. So I want to point that out as a surveyor, as a AAAC surveyor, of course, is the importance of making sure you have good documentation that you followed up with the patient after the procedure was been done. Even if it wasn't a real person, if everything was perfect, as you mentioned, Spencer, if everything was perfect, then the computer, the message went out, did you have any complications? The patient texts us back and says, no, everything was fine. That's great, but you still have to have documentation of that, which a standard texting solution is just not going to have for you.
Right. Just from somebody's cell phone, right? CMS comes on site and says, hey, show me your post-op check-in. Oh, Susie texted her.
Not to mention the whole issue of
that somewhere. Right? Versus, if you've got a real, be it some sort of connection from your EMR, your scheduler, there are places that offer, solutions that are robust and in terms of, hey, we do all kinds of things. And then there's ones that just say, look, we're going to automatically log it. You've got your dashboard. You've got everything you can see here. CMS comes on site, says, hey, show me your post-op follow-up for Derek for Wednesday. Okay, here it is. Done.
Ultimately, all of this leads into patient satisfaction, though, improving the patient experience, making sure that the patient has good things to say about us afterwards, especially as we move into the era of OAS caps, where CMS is going to require us to not only do patient satisfaction surveys, but really track it in a consistent way across the country. So as we move into the OAS caps areas, that's going to take effect in 2023. We really want to have better ways of making sure that our patient satisfaction remains high. How can these alternate communication systems help improve patient satisfaction?
I think it goes hand in hand with everything that we've been talking about so far, with hitting that easy button in terms of their communication, right? Because from a patient experience, if they don't remember to do their prep work, if they don't remember to show up on time or get delayed, or they drink their coffee, while it's their fault, right? You told them, hey, this is what you're supposed to do. If they forget and they show up, now they've blocked out their time to come in. They've taken off work. They've showed up. They've come in and they can't do it. That's still a negative experience, be it their fault or otherwise. They don't really care, right? And that's, one of the ways is just saying, look, we know, and accepting and empathizing, you have a busy life. This is something outside of your normal day-to-day that you're already doing. This is an extra step. We need to make it as easy for you as possible. Those sort of things. And I would say it goes all the way through. Hey, I don't have to step out of my meeting, see who's calling me. It might be my doctor. I got to see if it's important, or I'm waiting on results, right? Just text. I'm in a meeting. Great. I've got my update. Do you need us to give you a call for any reason? No, you can handle that in a meeting. Mm-hmm. And then the same thing with bill pay. So personally, not only do I work in the space of texting and healthcare and all of those sort of things, but I've got a daughter who's 3 and a daughter who's 1, and pediatrician appointments are all the time. And I'm very guilty of being caught behind. And the pediatrician just texts me, hey, you owe $160. Click this link and pay it. So it's not even, there's a bill waiting for you to view and this and that. They just flat out say, you owe this much. Can you pay it right now? And for me, in my experience, I could just check that off the list. That's one less thing in my, busy life that I've got to think about, or, is occupying space in my head. I can just get it done, click the link right from my phone, move on. Right?
Without pulling up another app or worrying about another method.
I don't have to pull up an app. I don't have to go to a computer, right? Look things up. I'm not pulling a piece of mail. Where did it go? And there's a website. Let me type it in here with no typos, or I forgot my username or my password. But it doesn't exist. Just click here. Your phone's going to remember that username and password. Click, done. And now I'm back to eating my salad at lunch or whatever I was doing before, right? There's no interruption. It takes 2 minutes. So all of those sort of things as well. The more things we can hit the easy button on, the better that patient experience becomes. And those satisfaction surveys go hand in hand with it, right?
It seems to me too that this is instantaneous. We know when we send out surveys, for example, patient satisfaction surveys at the end of the month, or under OAS caps, where we might, we'll get the results 30, 45 days afterwards. That's a long lag time to get that information. Aren't you also suggesting that this is a much quicker way of getting this information back almost in real time?
If you do it by text, it's absolutely real time. There's a real time. So a lot of ASCs that I work with will say, hey, can we just do like a 1 to 5 rating? I mean, the surveys and the scores and all of those things, those are good. We definitely want to improve those. But as a facility who's looking at and earnestly trying to improve that patient experience, we want the real time feedback loop, right? Mm-hmm. 1 to 5. How's your experience?
And fill this out before they fill out the OAS caps, survey. In other words, that way you can get the feedback. You can figure out whether there was any misunderstanding that resulted in that bad rating. Maybe calm them down a little bit. Whatever needs to be done in order to make them happy if something didn't go quite perfectly during that event.
Mm-hmm. Well, that's one of the human elements of things. If you go, buy a car and you just buy a car, you just walk away and you go, my experience was okay. But for whatever reason, if you go buy a car and something was wrong and that dealership says, no, bring it back in, we're going to take care of it, and they fix it and they're due diligent, you feel like you had a better experience.
You turned it around.
Exactly. That works, right? So same thing with surveys as well. You start to see those types of responses. Anything you'd like to add to that? I felt like they really cared about my experience, and there's an issue and they jumped on it right away, and they wanted to make sure that I was completely taken care of. So having that opportunity also gives you that improved boost when you've got the real time ability to see, hey, this is, the issue. We can resolve it very, very quickly.
So Spencer, I'm old. Sue is, of course, a lot younger than I am, but personal touch, it just seems to me, I want to be on the phone with somebody. I want to talk to somebody. Now, I think there's a couple problems with that. First of all, as I said, I'm old. And second, the world is moving on, let's talk a little bit about that. I mean, I think there's a lot of myths out there about how this type of communication could be impersonal.
I love the personal touch because, as you pointed out, it is a myth. The things that are moving, the way that communications and personal touch are moving on that continuum of, it's becoming to the point where if it's not already there, if you're calling me, you don't know me. You're not in my inner circle. Mm. Nobody calls me, right? If they're in the inner circle, they text. they know. So the businesses that I work with, my Amazon, they text me updates, and my delivery driver doesn't call to see when I'm going to be there. Just, hey, your package is going to be delivered around this time. My friends and family, hey, this is what we're doing. Okay, great. Now we don't need to call and plan it out. So that inner circle really is the text and the technology. But let's just for a moment say, okay, but there's a population where that's not true. When you said, hey, I'm old. I prefer a personal touch, with the air quotes that I'm doing on here. Let's not say that we are forcing everybody to text, right? You're just adding another communication channel. You're adding another option for those patients to be able to choose, how do I prefer to be communicated with? So the standard TCPA compliance is you have to let them know, hey, you're being opted in for this. We're going to give you some valuable updates and ask you questions, or this is a communication channel for us, but you can reply stop at any time. So that's the thing that I always want centers to understand when they're making a decision like this, is that you're not, by saying, hey, I think that they prefer a personal touch, you're making that choice for your patients, and it might not be the right call. And you have to be, and if you are making that call, you have to be at least 50% accurate or better, right? If I'm going to make this hard line, at least I want at least half of my patients, or 51%, to like it more than the other. Otherwise, I'm wrong. So texting, it just gives you the option to say, for those who want text, great, they're going to remain opted in and they're going to text. For those who want a personal touch, they're going to opt out, and we're going to be calling them, right? So, with those things, first off, the personal touch, believe it or not, it now is the text. That means you know how to communicate with me. You're in the inner circle. We can go back and forth, and I will let you in. If you're calling me, you're probably 80% likely I'm going to screen that call, 80% chance. So then moving the other way too. And I don't want to ignore the fact that nobody who is in texting, I don't think, if they disagree, maybe you run for the hills, but I don't think anybody would say, hey, every communication should be a text. No, it just gives you another tool in your tool bag.
Well, it seems to me too. I mean, you're absolutely right about, when you get a telephone call, you have to answer it right away or listen for the voice message that comes after it. With a text, you can choose to answer it now. You can choose to answer it later. A lot of people, and myself included, right now, as much as I say I'm old and all that, taking phone calls when you're getting, hundreds of communications a day from people literally just kind of interferes with your daily schedule, because those are things that they're not on your daily, calendar as to who you're going to communicate with at what time. They're interruptions.
It's an interruption.
Yeah. Can you talk a little bit about the different demographics that we run into? Is your experience that older people have more of a problem with these types of texting solutions than younger people do? I mean, I think we can all agree that younger people have no problem with this communication. What's been the experience with older people?
So there is a line there, but I don't think that line of differentiation is where everybody thinks it is. I think that when we group people, we forget to include ourselves in those data sets. I'll talk to physicians and doctors and go, I don't know. I don't think people over 50 text. Oh, sorry. How old are you? I'm 70.
If my 90-year-old mother can, right? If my 90-year-old mother can text, anybody can text.
Except my mother.
Right.
That's okay.
Oh well.
She doesn't look at her email or answer her phone either, so I don't know.
My grandma, so she is. We just went and celebrated her 86th birthday, and she texts. Purely so she can get photos of the grandkids.
Yeah.
That's it. So
that's exactly right.
The rest of the stuff, she could take it or leave it. Doesn't want to miss out on those photos. So, is it her preferred channel? The answer is no, right? She still prefers a phone call, and she likes that. But she is texting, and she's not going to miss out on that channel, right? Because there's an opportunity lost there for her, since we don't live close by. But when it comes to texting, yes, there are things to the age demographic. There is a drop off there, but we are talking about saying, okay, if you're like 70 plus, So up to 65, it doesn't matter. That demographic, those are the people running your companies and running the country and doing all of that. They are connected. They're in. So once you get into the upper echelons of, 70s, 80s, now we're talking there's a drop off. So that's the first thing to know is like, what percentage of your population is in that bucket? Because that's where you'll see that drop off. And when I say drop off, I'm talking about, hey, 98% of Americans have the ability to text. Whether you have a smartphone or data plan or not, you've got the ability to text. And the drop off goes to like 92%.
Yeah.
So hey, if you're getting screened 80% of the time, what if you could just get a confirmed delivery rate or confirmation 80% of the time? So you flip your, hey, I can only connect 20% of the time to I only didn't connect with 20% of the people. That's a massive shift.
Yeah.
So there's not a big risk to doing something like this because you still have your phone. We're not taking your emails away.
Yeah.
If you do something like this, you've got all those channels. So yeah, there is a drop off. It is real, but it's not this big, chasm that people think it is. It's not this huge gap. There's a small drop off.
Yeah. Now we talked about how, this is not something you can do with your cell phone. This is not something that you can do with your, you don't take a bunch of nurses and say, hey, here's a cell phone for you. I want you to use this for company business and text all the patients from it. Well, first of all, talk about the reasons why you can't do that. And then talk about how do we choose a solution out there? There's a lot of options available, new options coming out every day. So start with why can't we use a cell phone and then transition into what should we be looking for when we're looking for a different solution?
There's so many reasons why you can't use a cell phone, namely because as a business, how do you control that?
Yeah.
How do you control and monitor what's being sent back and forth there? So that's a huge risk. If you've got a personal cell phone, well, it's a lot easier to lose a cell phone, for example, than it is you can't lose the internet, right? You don't have that ability to just go, oh, we've misplaced this. So,
and there's no documentation trail. There's no easy documentation trail. You can't separate it out by patient. And then by the time you have, 2,000 text messages, you got the same problem that you had with the emails before.
Right. Exactly. Right. So when you think of that documentation and where do you house all of that? And then, are the messages being encrypted in transit? Are they encrypted at rest? Who's securing all of these? You're going to want a standard and a staple when it comes to the protection and all of the compliance regulations. You got to have somebody who's checking all of those boxes and making sure it's up to date. AT&T isn't doing that. They're telecommunications. They're not in healthcare, right? So you want a healthcare company that's got that technology in there to make sure that they're keeping you compliant, right? And then to all of the points that you said too, with, hey, where are the records being kept and all of those sort of things. And then from a workflow standpoint, think about that as well. You have a solution where you could use your keyboard anytime you go and you can text back and forth. You've got a dashboard. You can see all of the responses that you're looking for. You can parse them out. Can't do that on the phone. You're texting individuals, right?
Well, and if you have more than one person that's doing it, how do you coordinate those different? How do you make sure somebody doesn't call the same patient?
Right. It should be in a singular dashboard so that there's that transparency. Everybody knows what's going on, and you've got that accountability in there as well. So. And then to your point, some of the things that you should look for in a good texting solution, I think automated messaging is the number one, right? That's number one with a bullet. That is, whenever you've got the case that gets scheduled, you should be able to automatically send out messages before or after. So if it's part of your EMR, your case management solution, these sort of things, it'll automatically integrate. If it's not part of that, if you're doing another vendor, make sure it integrates. Mm-hmm. So your staff now is just saying, hey, we put in a case. We're just removing all the phone calls leading up to the appointment and the follow-up afterwards. And the dovetail off of that is that I think that a good solution is not going to be a notification system. It's not going to be one-way communication of you just giving updates. We are asking for data back from you as well, because we want you to be able to self-identify if you're not having issues, if you don't understand your instructions, if you do need a call from a nurse or anything you're unclear of. We want to be able to see that and see if it's triage. The next thing that I would say, I would say 2 more checkpoints really on a good solution, in addition to what we've already said, is what about the ability to individually text or respond to a patient? So I've called you once, I've called you twice. Now what? You have a voicemail you're just stuck, right? You can't get in, you have an unreachable patient. But if you have the ability to one-off text an individual, you could say, hey, this is who's calling you. Yeah. It's your care provider, right? This is me. I've got important information. I can't text you necessarily, right? We're not trying to make everything in text, but I got to have a phone call with you. I'm calling from this number, or call me when you're available. So you can reach unreachable patients in that way as well. And then the final good checkpoint that I would say is, what about your one-to-many? So it's not automated necessarily, but if, hey, we've got a blizzard, hurricane, flash floods, wildfires, doctor is sick, whatever the case may be, how do I update a large subset of those patients other than calling them one by one?
Well, and especially if you're not in the surgery center, like we live up in the Northeast, the major storm here, of course, caused a lot of our centers to have to shut down and cancel. And if they didn't take that list of all the patients before they left that day, to make those phone calls, they're in trouble. Somebody had to go into the office to make that call. Now, of course, modern computer systems and modern EMR systems probably gave them access to that remotely. But again, without an automated solution, you're making 45 phone calls if you got 45 cases scheduled for the day. Automating that is going to be great.
That's something that most people don't even think of, right? You thought of that one right away. Yeah. A lot of people don't even think of that. And I think that for a fundamental system, that may not be necessary. I know that's a differentiator with us, that's what we bring to the table is, guess what? You have to cancel all of your appointments for tomorrow morning because you're going to be snowed in. Don't go run into the office before the snowstorm really hits or this. Stay on your couch. Keep your red wine and your popcorn and your movie going. Just log into the system. You've got the internet, so just log in and all of those. So, software as a service or cloud-based or remote access, that is a definite plus.
And the reason I went that way, Spencer, because I was the guy when I was the administrator who had to make those 45 phone calls or who had to go into the office to get the list of all the patients because he didn't know that there was going to be a snowstorm the next day and didn't bring a list home with him. Yeah. But obviously we have different solutions today, but often it still means a phone call, unless you have an automated solution. That I agree.
That's something that blows people's mind when, they go, how do we set this up? When are you going to be here? When are you going to do an on-prem setup? And how many computers can we put it on? No. We're going to hit the easy button. You want to hit the easy button for your patients. We're going to do the same for you. And just make it, if you've logged into Amazon before or any other online account, it's exact same sort of deal there. So that one I would say you teed up.
Well, Spencer,
that was on your checklist of things to hit that easy button.
So Spencer, I've got a tiny little surgery center. I only do 5 cases a day, 3 days a week. I can't afford this type of solution, right?
Nah. The good thing about these solutions, so whether it's ours, another one, pricing wise, I think should be scaling. So it should match. You should have the ability to set up a program that works well for your facility. And that includes cost and budget, right? Just as much as functionality. But I have seen time and time again, without fail, if you're making an investment in something like better communication, texting, these are not expensive setups. If they are, they shouldn't be. You need to go somewhere else. You need to shop the market. But the return is there. So there are few products or services for a business that are going to meet three standards. One is, from the top, from the board of your ASC, they want to know, does this make me more money?
Yeah.
Yes, absolutely. If you're not having 10% of your schedule fall off because they aren't compliant or they didn't show up or they went somewhere else after they scheduled with you, that directly makes more money. Hey, can it, improve our workflows? Can it reduce our cost? Can it do all of the things that my staff also wants it to do while it's making me money? Yes, right? Texting can do that because it's just very, very simple, very affordable, and it in itself is an efficiency. It's built to be quick, easy. An SMS, which is a text, is only 160 characters.
Yeah.
And then the last thing that box that it checks is, can it do all of that without sacrificing the patient experience? And as we talked about earlier, it actually improves the patient experience. You're going to get better satisfaction scores. So hey, if you're the administrator who was in charge of managing vendors as well as staff workflows, help me out if you can name a product or service or a vendor who actually could deliver on all of those. It produces an ROI. It actually reduces costs, improves the workflow, and improves the patient satisfaction. That's hard to find, especially at a price point that's quite reasonable.
Yeah. So, the scalability, looking into the scalability of the product is extremely important because hopefully that one place that does 5 cases 3 times a week is going to grow into the big oak tree that, does 300 cases a week. But if you have to change solutions in the process, then, you've wasted quite a bit of time.
Yeah. For me, that's a checkbox that I love because I've seen the value of that over and over. Yeah. Hey, we've changed case management solution systems. Hey, we've changed our EMR. Hey, we've changed schedulers. Hey, we've changed billing softwares or whatever. Well, great. You don't have to throw the baby out with the bathwater, right? You don't have to throw out all of your history of communications and records and things like that because you changed one of your vendors. So being a platform agnostic it's not the baseline fundamental that you need when you're looking for a good software solution, but it certainly helps if and when a business decision like that is made is, well, great, here's one less thing we have to change.
Spencer, this has been great. We don't always talk a lot about patient engagement on the podcast, so I think it's about time that we have this conversation. So I've enjoyed our time together. Thank you.
Thank you very much. Thanks again for having me on. Really appreciate it.
Sure.